10 absolutely terrifying diseases you might have without knowing it. Number 10. Digestive Entero Deliquescence. The human body's stomach-related juices are staggeringly solid. Disconnected from the body, gastric corrosive would be incredible enough to eat through strong wood, and just the stomach's remarkable design holds you back from processing yourself. Bodily fluid ensures your cells, and the cells additionally produce soluble liquid, which kills acids that come excessively close. In the event that the corrosive figures out how to move beyond these guards, you may experience the ill effects of a peptic ulcer. As excruciating as ulcers are, they ordinarily aren't too perilous in light of the fact that, once more, your stomach and digestive organs have a few protections against gastric corrosive. Different pieces of the body aren't so fortunate. In the event that your corrosive backs up unusually through stomach-related vessels, like the bile conduit or cystic pipe, you'll get hit with stomach-related enteroautodeliquescence, in which your own body's juices break up your interior organs. One of the especially alarming components of the condition is the absence of manifestations before the quick beginning of organ disappointment. Despite the fact that the stomach and the throat react to overabundance corrosive by conveying your cerebrum messages of sharp agony, numerous lesser pipes associated with the stomach-related parcel have a very surprising kind of nerve. You have no typical method to recognize the presence of corrosive in these entries until they out of nowhere convey their destructive substance. The corrosive at that point frequently enters the internal organ, yet it might likewise, and considerably more truly, enter the gallbladder or even the liver, bringing about obviousness followed by quick death. People primarily frail in their anatomical center have a higher danger of stomach-related enteroautodeliquescence. While in a sitting position, take a stab at twisting forward so your head contacts your legs somewhere between your hips and your knees. Endeavor to loosen up your abs, and afterward contact your midsection just beneath the rib cage. On the off chance that this territory stays inflexible with no exertion, you are not particularly vulnerable. Number 9. Peabody's diminution. At any point was truly downright awful? Is your number 1 baseball cap somewhat looser than it used to be? On the off chance that you contact your ear cartilage with your thumb, does your pinky finger arrive at the external edge of your contrary eye? Assuming this is the case, you may be encountering the beginnings of a hazardous ailment, Peabody's diminution. Stop briefly and think about all the radiation flying all throughout the planet today. Nowadays, radios are in all things: cells, GPS units, microwaves. Indeed, even clock radios. Also, there's abundant proof that radio waves are the abhorrent managing power behind a sluggish-acting disease that is taking the globe by quiet storm. The first victim was a Mr. Whittaker Peabody, an early guinea pig of Thomas Edison's. At the point when radio waves were first found, Edison, known for a touch of savagery in his examinations, picked one man to test the impacts of the waves on. Following quite a long while of direct openness to the skull, Mr. Peabody's head started to contract. He detailed devastating headaches and horrendous torment. He before long left Edison's utilize, however the impacts proceeded until his head was about the size of his clenched hand. All photographs and records of the tests have been stifled by the public authority, without a doubt some portion of some psyche control plot. The above is presumably the just one in presence and has held its horrible mystery every one of these years. We just scholarly of it through the charitable participation of the Peabody domain, in spite of the fact that they will unquestionably confront repercussions for permitting us to distribute the story and the photograph. Number 8. Adulescence. Skin breakout is an ordinary piece of growing up. 8 out of 10 adolescents and juveniles do fight with clogged pores and pimples consistently. While the reason isn't completely gotten, chemicals and microbes unquestionably assume a key part. But at the same time there's adolescence fiery blaze. First found in 1988 in a little town outside La Salina, Colombia, this exceptionally forceful retrovirus is a youngster's most noticeably awful bad dream. Adolescence fiery blaze makes itself at home in the epidermis, vanquishing skin cell after skin cell. As it rules the derma, it causes an emission of profoundly infectious skin inflammation, frequently covering entire parts of the face. So what's the serious deal, you inquire? All things considered, adolescence fiery blaze wouldn't be so terrible on the off chance that it remained on the skin like typical skin breakout. Be that as it may, it doesn't. In right around 87% of recorded cases, the infection relinquishes the derma and works its path more profound into the body. Ready to move at nauseating paces, the retrovirus assaults muscles in the cheeks, nose, throat, and mouth. Fundamentally, that implies casualties have skin inflammation becoming inside their tongues. What's more, since these zits are shielded from creams, prescriptions, and pimple-popping fingers, they can expand to tremendous sizes. Left unchecked, adolescence fiery blaze can cause genuine facial deformations, inconvenient sculpting, and inevitable suffocation. Although the infection apparently vanished during the 2000s, it raised its terrible whitehead in mid-2013, killing a secondary school sophomore in Odessa, Texas. Tragically, while the illness is repairable with quick treatment, most casualties don't know they've contracted adolescence fiery blaze until it's moved into the terminal stage. All things considered, its first and most clear indication is an unexpected and rather misleading beginning of flaky red skin and ooze-filled pustules. In any case, if the erupt agrees with the appearance of strange projections inside the mouth, nose, or along the tongue, odds are beneficial things are going to get gross. In any event, no one will ask you out to prom. Number 7. Pulmonary lenticellular ichthyosis. Human lungs are made out of a mass of elastic tissue that is intended to be amazingly adaptable. The internal tissue of your lungs is made of a sheet of wrinkled cells that folds in on itself many occasions. In the event that you could extend it level, it would cover a region about the size of a tuxedo. It's planned that approach to boost the surface region that air can hit, permitting you to pull in more oxygen with each breath. Sometimes, however, that adaptable tissue doesn't act the manner in which it ought to. In the years since the principal case was seen in 1983, we've been seeing a quickly expanding number of instances of respiratory lenticellular ichthyosis, regularly alluded to as lung bark. It happens when the external layer of tissue on the lungs scabs over and solidifies, shaping a shell like the bark of the tree. What's more, comparable is putting it mildly, the solidified lung tissue really has a mineral profile that is 86% like the bark of the normal beech tree. The issue is, the sickness is almost difficult to analyze without a post-mortem. It presents no outer indications, and the solitary time we at any point see it is in situations where a dissection is requested for an alternate explanation, for example, for the survivor of a crime. In any case, the numbers are striking. 53% of dissections requested in the previous decade have uncovered respiratory lenticellular ichthyosis. In one examination, the lung bark was so solid it couldn't be broken with a sledge. Furthermore, in what you may call an amusing turn, cigarette smokers seem, by all accounts, to be insusceptible to whatever causes lung bark, persuading that it very well may be brought about by a microorganisms that is exceptionally powerless to carbon monoxide. For example, the tissue-eating variety of Silenicaceae. Number 6. Sudden onset dental collapse. In 1936, Joyce Merrick was having lunch at a cafe when she clamped down on something hard. It ended up being a tooth. Contacting her mouth to discover which one was missing, she found that every last bit of her teeth felt free and unstable. Another left away in her grasp when she contacted it. In the space of around 5 minutes, everything except 2 of her excess teeth had dropped out. Specialists verified that the nerves inside her teeth had all kicked the bucket, and blood had stopped streaming to the encompassing tissues, leaving them powerless and unstable. What put forth this defense so peculiar, aside from the fast beginning, is that in the months paving the way to it, Merrick had a progression of dreams obviously anticipating the occasion. In some her teeth had felt unstable, and dropped out in fast progression, while in others they were staggeringly fragile, and disintegrated in her mouth. Since the Merrick case, numerous different casualties of unexpected beginning dental breakdown have been considered. Every one of them detailed comparable dreams, just as intermittent prickling sensations in their gums. Albeit not broadly comprehended, the common hypothesis is that, the neurological framework being so firmly associated, Nerve passing in the mouth straightforwardly impacts the prefrontal cortex, the space of the mind liable for dreaming. Positively, there is a connection between dreams of bunches of hair dropping out and late life diminishing hair or sparseness in ladies, likewise accepted to have a neurological reason. In men, sparseness isn't viewed as pathological. In the mid-1980s, survivors of unexpected beginning dental breakdown campaigned the U.S. government to subsidize a public mindfulness crusade, empowering those encountering teeth dropping out dreams and prickling gums to see their primary care physician quickly. Yet as the condition is so uncommon, it was felt the expenses couldn't be supported. Number 5. Credula cerebrum morbo. Credula frontal cortex morbo is a degenerative mind sickness brought about by the repair hatchet infection, and it's seen an inquisitive spike in the number of cases as of late. It's a profoundly irresistible sickness, influencing all age gatherings, sexual orientations, and ethnic gatherings without separation. Maybe the most heartbreaking thing about this infection is that the beginning stage manifestations are frequently thought to be minor to such an extent that the influenced individual regularly expects nothing isn't right until the sickness is too cutting edge to even consider treating. These indications incorporate aggravated eyes, obscured vision, back and neck agony, migraines, and exhaustion. Nonetheless, whenever left unchecked, the infection assaults the neurons in the cerebrum, and throughout an all-inclusive time frame, it can prompt diminished fixation, distraction, inability to perceive recognizable individuals, spots, or things, and surprisingly infrequent hazardous incontinence. Ultimately, the infection annihilates such a large amount of the cerebrum that even organ work starts to close down, bringing about death and conceivably much more incontinence. Shockingly, there is no known fix. Treatment comprises a greater amount of drawing out the unavoidable, as opposed to annihilating the infection. Each individual determined to have credula frontal cortex morbo will kick the bucket eventually in their lives. It's a capricious executioner and has been known to run its course in only months or loosen up and cause casualties to endure now and then as long as an additional 70 years. On the off chance that you are encountering any of the early notice signs, you do well to get yourself looked at. Number 4. Dissociative unipolar hypersensitivity. Have you at any point attempted to stimulate yourself? It doesn't actually work, isn't that right? That is on the grounds that our somasensory framework is intended to treat outside upgrades, those coming from others and things, uniquely in contrast to any actual incitement we give our own selves. This is an essentially fundamental arrangement. Consider the big picture. If your body treated your own touch in a similar way it treats other people's, you'd be not able to precisely recognize the two. More than that, you'd experience the ill effects of a crippling condition of steady tangible overstimulation. Basically, having hair would feel like something's continually squeezing against your scalp, your tongue would trigger a gag reflex inside your own mouth, and your very skin would give you an impression of being enclosed by plastic. So what happens when this perplexing instrument falls flat? For reasons unknown, results range from gentle and practically diverting to totally devastating. The umbrella name for this scope of side effects is dissociative unipolar hypersensitivity. Individuals with a feeble type of it might, for instance, squeeze themselves and rather feel like they've been tickled, or unintentionally cut a finger yet experience a consuming sensation. Those on the more genuine finish of the range may wind up withdrawing in torment while scratching their temple and by and large being completely unequipped for differentiating actual sensations. Current appraisals propose that upwards of 27% of the populace display probably a few side effects. This puts the all-out number of tormented individuals worldwide at over 1.9 billion. This implies that you have a 1 in 4 possibility of being influenced, without having seen it. One surefire technique to test for DUH is really direct. Take a pen or indelible marker and utilize its sharp tip to tenderly take care of your neck. Presently do likewise with the tip of your pointer. Preferably, the two sensations ought to be exceptionally simple to differentiate. In the event that you experience difficulty doing as such, you may at any rate be inclined to the problem. Do take note of that you should never self-analyze, so for additional assessment, kindly counsel your doctor and get some information about DUH. Number 3. Pineal parasitic infection. Back during the 70s, French specialists dealing with the Caribbean island of Virginia started to see a progression of strange side effects among their patients. The burden detailed overwhelming inclinations of exhaustion, expanded craving, and passionate and mental shakiness. In spite of the fact that they didn't have any acquaintance with it, the specialists were quick to identify the presence of the 20th century's quickest developing parasite, cognomen science, or the razor-upheld square worms. Initially influencing sheep and a few types of petrel, the square worms appears to have taken the leap toward people sooner or later in the last part of the 50s, however stayed undetected for quite a long time, basically on the grounds that disease remained moderately uncommon until the mid-2000s. Disease is described by unexplained sleepiness, disposition swings, rectal release, and regular pee, some of the time as frequently as a few times each day. Maybe the most uncommon component of the square worms is its capacity to impact have conducted through the creation of endorphins and other feeling-directing peptides, which the worm normally discharges. This permits the parasite to adjust its current circumstance to go for whatever itself might prefer. For instance, by delivering endorphins after the host has burned through a feast high in salt or fat, the square worm supports the utilization of comparative dinners. Essentially, whenever fomented by abundance development, the square worms can deliver the pressure-related synthetic neuropeptide Y, empowering the appropriation of a stationary way of life. Albeit already uncommon, square worms contamination rates have developed dramatically during the 2000s and keep on doing as such right up till today. Numerous osteopaths currently interface this development rate to change in dietary examples, especially the ascent of mainstream sans gluten eats less. Just as being delightful, excessive gluten utilization is deadly to square worms, which are seriously narrow-minded of it. Thus, on the off chance that you need to stay away from contamination, ensure you get a lot of gluten. Number 2. Sudden onset gluten intolerance. Could gluten execute you? 7 out of 7 specialists currently trust it could and will, anytime, abruptly. The protein composite has been connected to everything from coronary episodes to visual scaling, abrupt cranial release, and pancreatic verruca. Presently, a comprehensive group of researchers, Helmgens, and dietitians working out of Saskatchewan's Institute for Longaricophagia say that these apparently irrelevant impacts may, truth be told, establish part of a bigger disorder: unexpected beginning gluten prejudice. Scientists say sogi is getting increasingly normal and may as of now be at pandemic levels, and the manifestations may really be deteriorating in light of expanded utilization. New diseases accepted to be connected to sogi incorporate uncertainty, fits, weak bones, urethral dying, ingrowing teeth, meandering ligament, uncontrolled nerve bladder replication, miasma, macrobiotic psychosis, sudden ignition of the sensory system, breezes, gum corruption, tropical hypothermia, verbal mind flights, and skin problems. In an articulation recently, the senior UN Commissioner on Disease, Helen Hunt, exhorted that gluten be restricted totally from human utilization. This action stays questionable, yet has effectively been carried out in Guam, Micronesia, and New York. For those living somewhere else, the danger of sogi can be diminished through incessant exercise, obia, and a painstakingly observed liquid admission. Number 1. Hypochondriasis. Hypochondriasis, all the more normally known as despondency, is effectively the most popular condition on this rundown, and it's additionally the most pervasive. Victims may encounter no actual disease, however they regardless go through something far and away more terrible, the confusion that they do in fact have genuine sickness. Self-tormentors regularly wind up scrutinizing assortments of dark problems and in any event, directing strange self-analysis tests that abuse normal sense. Originally, specialists accepted that depression was a reaction to common low self-assurance or an outcome of noticing genuine infection. Yet, with the ascent of the Internet and the tremendous surge of data it brings, social researchers say numerous individuals have quite recently built up an undesirable fixation on arbitrary bleak stuff. Also, It's essentially amusing to envision that you may have a surprising and insane destiny in front of you, maybe then simply recognizing that you will bite the dust because of your stationary way of life of sitting before a PC all the time. Most as of late, financial experts and taxidermists have presumed that anxiety is nevertheless a solitary aspect of a bigger problem, outrageous guilelessness. Victims of this problem, suckers, will in general accept anything they hear or read. Anything that is connected to an outside asset seems real to the simple. In any event, when the asset is totally untrustworthy, contains no supporting realities, or even comprises of complete gibberish. Though no moment fix exists for one or the other despondency or credulity, barely any specialists recommend forsaking all expectation. Numerous victims have figured out how to turn their lives around by treating themselves with ordinary dosages of distrust, right now not controlled by the FDA. In the case of something appearing to be impossible, or even very intriguing, read up further on it from each source you can discover. You may find it isn't accurate in any way. Or then again you'll see it is valid, and you'll gain proficiency with a ton more about it, which is as yet a decent utilization of your time. Truth be told, it's the second most ideal way you can utilize your time, just in the wake of protecting your home against raging space bats.